Hello, my name is Keith Bennett, and I'll be talking about my practicum I did over summer with Essential Health. It was a gap analysis on the health and wellness of the Essential Health employees, more specifically in the inpatient units at the 32nd Avenue Hospital in Fargo. And a lot of this idea came up from someone I knew at Essential Health. She's the vice president, more specifically with patient units and ambulatory services, which is my proctor. And she came to me with this idea to do some sort of evaluation on the employees there. So we'll go on to the steps in the project. This is kind of taken from the template from North Dakota Works at Wellness. And so a lot of these steps were management support, where I met with administration of the West Region Essential Health and to get some sort of support and backing on the project that I conducted, and give me resources and communications and connections throughout the region. And then second, create team, which is kind of my key stakeholders that I'll be talking about in a minute here. And then three was collecting data, which was in three different ways: surveys, focus groups, and then interviews, which I'll be talking about in a little bit. And create an operating plan to how to implement these, implement analysis, and implement the data I've found, and to choose interventions. Number 5, where I'm currently kind of at, choosing interventions. I'll mention a few here, or programs you can call them, to eventually create the supportive environment, changing the environment to be more healthy or optimize wellness. And then in the future, hopefully Essential Health will evaluate these programs or interventions. So the key stakeholders you can see here, some of these people are like chief operating officers or managers for nurses, director of community health, marketing, human resources, leadership and development, and maintenance, things like that. These are my key stakeholders that really helped me gather resources and communications. They really helped out to overcome my hurdles that I had to overcome, either technology or to who I should talk to about certain subjects pertaining to physical activity or nutrition or mental health, all those aspects. So how would I collect data? With 3 ways: surveys, focus groups, interviews. And for surveys, I did 2 different ways: online surveys and hard copy surveys. So with online surveys, I used SurveyMonkey, and this consisted of 10 questions, very vague questions, are kind of taken out from the health needs assessment from NDSU, and I can only use 100 responses. That's plenty of responses that I need. It's perfect. And then also I did hard copy surveys that kind of elaborated more on the questions about health and wellness. So a lot of these were pertaining to physical activity, nutrition, sleep, stress, knowledge about benefits, how many hours a week, and then of course the usual demographic information. So 10 were completed with these hard copy surveys that usually I did amongst focus groups or interviews or just random people I found. Only 10 were completed for this one. So focus groups, it was randomized randomized invites from basically all of the units. Usually there's 1 or 2 representatives from each unit that were volunteer toward. And I have 3 dates that we did focus groups for. And these groups ranged from 4 to 10 participants each time. Really great discussion. Really get in-depth information and insight on what needs to be improved or what is good at Central Health for employees. And then we did interviews that was conducted over 2 hours of random people coming in, and we talked for a short amount of time, from like 5 to 15 minutes, just giving their opinions and things like that. Only had 6 total participants for that, but it gave great key information that really helped out with the project overall. So the analysis came in from surveys, these online surveys. Thankful to SurveyMonkey. It kind of gave me percentages for responses. So among all these, the highest concerns were just these top 5, not pertaining to how much they're not more concerning than each other. Just these are the top 5. So availability of good walking or biking options, workplace safety, poor nutrition, lack of physical activity, and stress were the top 5 overall. And also some key things that came in I found interesting in the survey was rating of own health. Most of people responses was good or very good. As you see, it's about over 84% participants said their health was good or very good. Would be interesting to see if that's true or not, or that's just perception. And then another key one was the knowledge about employee benefits. Most said some, which raises a flag, and this will come over and over again with the other data collections you'll see. And stress at work, most of the time, was a big one, 41.05, which you'll see again in other collections. So hard copy, as you see, is similarity to what the online surveys were. Availability of good walking and bike options, sterile use, poor nutrition and eating habits, sleeping disorder. And then a big one came up was about stress. How often do you? Over about 60% of participants say most of the time or always. It's a massive amount. Employees want to know more about the employee benefits. That was another red flag that came up that needed to be addressed. And also there was comments more specific about safety. As you can see, security of entrances, walking to parking lots, insufficient restrictions to access points. Analysis from focus groups. As you can see, all this of key issues. Something came up about night shifts now. Night shifts at hospitals, as you know, it can be really stressful and hard on employees, more specifically to nurses. And food, what came up to be as a point of interest, that we're needing more food options, healthier food options. And also another one's about knowledge of employee benefits, another one. And all this was about stress, really all connects about stress. Pretty much everything I've found can connect to stress. So anything I can find to implement to help out with those things, like those activities, sleep, nutrition, that will help for stress, be more resilient. Is they essentially like to say, be more resilient, not call it stress. So we'll go analysis of interviews. The key points from one-on-one interviews was another one came up. It was on-site daycares. That never came up, and then until now. Then on-call stress kind of made it hard to sleep, mixed into personal life. Another one's about quiet rooms or break rooms that are more kind of like for have a kind of a escape from work while you're at work. Really that's actually be something coming up in the near future for Essentia. Extra staff, they need help with staff is another one. Longer lunch break. I'm sure all of us would love a longer lunch break. And using badges for food discounts, which is actually changing. I'll be talking more into this presentation. So the correlations or recommendations from what I found from all the information, as the correlations in 3 forms of collecting data: the variety of food options, physical activity, stress, number of staff, and overnight shifts, were the big 5 that came up the most. And the recommendations, I would say, was the create opportunity for employees to be active during or around their workplace, bring in more options for food and cafeteria and vending machines, and resiliency training for employees. And like I said before, all these programs mentioned that has potential of becoming more resilient to stress if educated properly. Because all these connect to stress, all of them, in some way and form. So this was a very big discussion point with the administration and managers and supervisors, was for the program's ideas. There's a total of, I believe, 7 or 8 points of programs that came up. So there's walking routes that will come soon in the future, and there's a number of options, and hopefully it will have maps, flyers, information for employees or even anybody in the hospital to use. And I always put the initial connection for this, for Essential Health, their connection to their goals for the year. And then number 2 here is on-site group fitness classes that we already started. So I started with yoga, bringing in the yoga sessions, free yoga sessions for any employees now. And then there's nurses were actually starting to do an incentive program called Essential Health Stronger Together to help out with nurses to take up hours and help out each other. And prizes were given, like Fitbits and scrubs, other clothing, and also then each month we do kind of like just a gift back. So like, yoga sessions is what we had. In August we'll have massages, and then September walking routes, like I mentioned, we'll have in September. Now we'll go into the Take Charge program that's already Essential Health does every year. That promotes doing a health assessment for all employees and choose kind of a physical activity program to do, and then they get like a certain amount of money off of their health insurance. It really helps out. I'm even thinking of doing it. Number 4 was more healthy food options. This, especially for overnight shifts. Actually, as you can see, there's a lot of programs coming out with this. They're having an expansion at Essential Health Hospital, which was one of my hurdles I had to overcome, because there was a lot of moving around. I had to be off-site sometimes, or a different building, different campus entirely, with a laptop. So I had a virtual desktop with that. But so with the new expansion, there'll be a new kind of cafeteria. So a new opportunity for creating a healthier environment, to strategize where to put certain foods, certain options in the cafeteria that will make the healthy choice the easy choice for anyone. So that'll be coming up soon to help out with that, I hope. So also there's mindful labels that kind of like introduce certain meals, healthy meals, and nutritional facts with that. And go into more employee debriefing. This is more of the kind of stress part or mental health. They already have an employee assistance program, but it's a phone call tool where they call and basically debriefed, and then also you get 3 free counseling sessions if they wanted to. And a person from East Region or Duluth area, Dr. Leon, is developing a kind of I'm trying to remember the name. It's called a SARI program, where it will include debriefing, mandatory debriefing for employees in crisis situations, as in maybe death or shootings, things like that, that help with their mental health. Then number 6, biometrics. A person of Chuck Ulrich is developing an idea for team assessing and coaching task team for employee health, to go out in certain companies to have the whole package. So you do a health assessment and also have the coaching right there to help out with anything that comes up as a health concern. You nip it in the butt right there. So something we are going to start this fall is during our flu shotlets, have a voluntary health assessment and coaching. So while they're doing their flu shot, after they do the flu shot, they can voluntarily take a health assessment or a biometric and see if anything red flags up or any health concerns, as in like high blood pressure, cholesterol, diabetes concerns, things like that. But anything that comes up as a concern, you have a coach right there to talk about it and give or schedule classes and education for these health concerns. I think this is a great opportunity, and I'm very excited for this one. So we'll see how it goes in the future. And then number 7, well, I guess I have 8. So number 7 here, community involvement. So Essentia is going to be partnering up with elementary school, EdClap. That's a new elementary school opening up right next to Central Health, basically, where we'll do kind of mentoring programs, career day, toy drive, food scholarship. But this mentoring program is very interesting, where employees from Essential Health will go over to the school and do either help out with before or after school programs, or have lunch with a child, kind of just be a mentor and a good example for young children. And then we also did promoting employees to be involved in the community, doing a volunteer team possibly. We'll see. As we already do, like in the near future at Go For Our Women, we'll have an Essential Health team helping out with volunteering. I'll be a part of that. And also we have we'll try to do like some sort of Essential Health employee competitions. Either that be like sports teams in the community, a volleyball or softball, and also an idea was to do an internal employee Olympics. So that would be like whatever unit against a unit, whoever lost the most weight or did the most steps, or how many people completed a health assessment, things like that, to promote those healthy exercises. And then number 8, employee benefit promotions, because a lot of employees don't know their benefits, where they can take advantage of those to even help them out financially and physically. So my idea, I told employee development and human resources, let's try to incorporate employee benefit promotion in the first week of new employment or during the first day of orientation. Just have a short education piece about what benefits are there that you can take advantage of. So also I do a program impact and cost with all of these. So as you see, there's a high impact and easy top left, high impact and difficult top right. So a lot of these things will cost a lot. So cost a lot will be right, doesn't cost much to left. And you see, like, walking around to be cheapest, most expensive would be like community involvement or biometrics or healthy food options on the right. this is kind of a good talking point that I did with the administration and leaders at Essential Health, to kind of give a visual of what can be done, what is the easiest thing to do, and a timeline. So with that, I created this with the help of Kristen Leb. She's a kind of a communication leader at Essential Health. So the steps in establishing a new program at Essential Health, more specifically. But this can be done with any company or any organization. I can incorporate this into. This is kind of like a template. As you see, there's a timeline and who to contact, scripting, things like that, to help out to better introduce a new program. I love this. This is what I'm using right now. It's great. These are my references, and thanks to all the people. These people really helped me out through the summer. So what did I learn from about public health? I learned that it is so complicated, but also so direct. There's so many pieces to public health, but you need to focus on your goal, your one thing you're trying to establish. What's your ultimate goal? And all those parts are just directly connected to that goal. And what did I learn about myself? Be somewhat resilient and flexible, and sometimes really patient. Some of the other troubles I had over the summer is my laptop crashed, and I lost all my data information on my hard drive. So that was very stressful and frustrating. But hopefully I overcame it, and I am doing the best I can. So this is my summer practicum, and I'm proud of it, and I'm hoping it'll transform and expand into either my career or for improving Essential Health itself. So thank you, and have a great week.